Workers, as I mentioned, looking at possibly the biggest jump in health insurance costs in 15 years. I mean, what is really driving this steep increase that we're seeing?
Well, we think the primary reason is it's a continuation of the recovery of healthcare spending from and use of healthcare that obviously fell during the COVID period when the healthcare system was basically shut down. And the increase in use of hospitals for people with COVID was more than offset by reduction in face-to-face visits and things like elective surgery for joint replacement and so forth. So the at least the official government projections suggest that the highest growth of spending should have occurred in 2024. We don't have the official figures on that yet, but probably they're right, and it's bled over into 2025. So what we're seeing is the result of a sort of echo of the result of the depressed use of healthcare during COVID,
Right.
for the most part.
Right. I mean, during COVID, as you say, I mean, companies kind of absorbed some of the rising costs to protect their employees. They're now passing more of the burden onto workers. I mean, why do you think there's been that change?
Well, of course, one thing is, as we know from last week's data, that the labor market is softening. So economists like me think that the primary way that people who get their insurance through their job pay for it is not in the explicit premium they pay, although that's going up too, but that's only about 20% of the total. Most of it comes out of the raises they would have otherwise gotten being canceled. And when the labor market was very tight, it was more difficult for employers to reduce money wage growth to pass on the cost of health insurance. So they ate it for a little while, but now that's all come, that sort of a perfect storm, that the labor market is softening just as the spending echo is happening.
Yeah.
And the consequence is a surge, according to Mercer anyway. They tend to be more pessimistic than what actually happens, because they're asking employers about their anticipation of spending growth rather than the fact of spending growth. But the punchline is this looks like a pretty difficult year for workers having to pay for their health insurance.